So thanks very much for the invite, guys. I'm really just going to give you an overview or a flavour of one of the a first year module and its assessment that we actually have as part of its core to radiography, but also to medicine. And it has a kind of a slightly innovative tool in the fact that we get our students to not just assess themselves, but also to assess each other, their colleagues in the group. So this module is actually, it's healthcare imaging and information systems. Like I said, it's core in stage 1 and it runs in semester 1 as well. So it's very much a kind of in their first few weeks here in UCD, and it's aimed really to give students who have a fairly limited experience of a healthcare settings an overview of the radiology environment and the healthcare environment. Really with the intention that the students would be able to, accurately and clearly explain to a layperson or ideally a patient what these technologies involve. So in the first few weeks we spend a lot of time going through each of the various technologies they might encounter when they reach into clinical. So we'll talk about plain x-rays, CT, ultrasound, MRI, nuclear medicine. So the student has a fairly good grasp of what's involved. So if they're ever asked questions, they can answer them competently, I guess. So what we do actually is one of the assessments for this module is that students actually will work in groups of 6 or 7. So the group, so the class as a whole is about 150 students. So obviously we're all familiar about group work can pose problems, or I suppose with individual assessments it adds to the group, the work for the module coordinator. So this group work, students work in 6 and 7s, and the aim is to design and compile a patient information booklet. Now this booklet really isn't, we give them a topic, so such as the ones you can see here, but it's not to address this topic in terms of informing patients, but it's to talk about the role of imaging for these types of diseases. So it has a kind of a specific focus or a slant. And we kind of give the students a remit of kind of being informative but accurate, and ideally we'd like them to be innovative and do something different and have something that's quite visually appealing. So I suppose why this assignment, especially when we're all familiar that a lot of students dislike group work in particular. They especially dislike when they're all given the same grade for one component that they all produce, so even though the workloads might differ a lot between students. But we see this as a really good opportunity because it's in stage 1, semester 1, and as well the fact that it's a joint module and it's core for medicine and radiography, and there's other elective students take it as well. So it's a really good chance for interprofessional learning. To get these groups mixing, we intentionally group students from different programs together, so there'll be a mixture of radiography, medicine and electives in each group. It's really useful as well to encourage student engagement. So in the early weeks when they're all just feeling their way around UCD, they all start chatting, meeting new people around who are in their program and in another program. As well, it does really start the active engagement and active learning process. And it's very, I suppose, relevant to their clinical or their professional lives afterwards, because they're designing a patient information leaflet. It's relevant to a topic that they will definitely be encountering when they actually start going out to practice. And on top of this as well, we actually have it, we use it in both a formative and summative capacity. So the students halfway through, I suppose, the 8-week period where they have to do this assessment or this group work, we get the students to formally rate each other and themselves, and then it's almost a practice go. They all get a feel, they know exactly what's involved, and then we actually use it for summative to assist with their grading. So it does, having a group work like this, it does assist with assessment for learning as well, because it's so relevant. So really what we hope to, I suppose, that the students will gain from this module is that they'll develop team or group work skills, and that's really important. We all realise that you're never just working as an individual once you're kind of qualified and working. And importantly as well, it does teach, inadvertently, sometimes it can teach conflict management, okay, when groups don't work as well as you wish they would. Very importantly, because part of the assessment is the students will actually rate or assess themselves and their peers, it does encourage reflection. It does get them to critically evaluate not just their own performance, but their colleagues as well. And as well, it gets them hopefully to bring out their creative capacities. Right? There's generally 1 or 2 members of each team will be really good in art, or they'll have a flair for something, and it's really good to encourage the group and bring them forward. So really just to give you a sample of the booklets, so these are just, I suppose, it's the standard patient information leaflet we might all be familiar with, where it's kind of a double-sided A4 that's folded into 6. Here it is just, so this is based on the imaging in multiple sclerosis. So you'll see how the students have designed it. Even some of the standard of these information booklets has actually been really good. And we've actually shared it with some of our clinical centres who've been interested in actually using them and adopting them for their own departments. So this is the backside of it. But then, again, we give the student an open remit. They can develop the booklet in whatever format they wish. So it'll vary. I've seen some really interesting material when it comes to paediatric issues. So some students have, just you can see in this booklet, they've actually not just presented an information booklet, but they've also presented a teddy bear which has an MP3 player in it that kids can listen to, okay, as opposed to someone who may not be able to read. Last year, a group of students they pretty much did it all via cartoons. So they drew the whole thing, again, for children who are after having an accident, maybe have to go and get an x-ray. So really, I suppose the fact of having self and peer assessment, what it has actually brought is it's kind of almost restored, I suppose, the students' sense of fairness in terms of grading. Instead of getting one grade to the whole group of 7 students, they're all getting an individualised mark based on their contribution or what their colleagues have seen their contribution. So the amount of, I suppose, their number of complaints is definitely reduced. The students really kind of actively engage, and we feel that they're definitely having a better learning experience. Again, peer learning has been really beneficial because we had that mix of medicine, radiography and electives. Everyone's coming at it from different viewpoints. So it really encourages the learning and kind of allows some people to kind of, I suppose, the students to educate each other as well. And as well, we have the team skills, the interpersonal skills and reflection attributes. So I suppose, how do we do this self and peer assessment? What we've actually been using for the last 5 years is a tool called Spark Plus, and it's an online software. It was initially developed in the universities of Sydney, and what it is it's just a method whereby the students can log on to this website. We've set up a set of criteria, and then the students will evaluate their own performance first and then their colleagues' performance against a set of criteria. And this is all done anonymously, and then the software in the background will actually amalgamate all this feedback and give each of the students an individualised mark, essentially. So it gives this individualised mark really by using 2 different calculations. The first one is a self and peer assessment factor, and that's essentially the weighting that we'll apply to their group grade. So while the module coordinator has the luxury of only reviewing 18 group projects instead of 150 if it was individual, we give a standard grade to that one project, but then this SPA factor then will be used to kind of moderate up or down each individual's grade depending on how they've been assessed by themselves and their colleagues. The students will also be given one other factor. It's called an SAPA factor, or self-assessment to peer assessment. And what this is crucially is it's actually a feedback factor. So it informs students whether they've actually overrated their own performance relative to what their colleagues felt, or if they've undervalued their own performance. So it's really a kind of I suppose, a reflective tool to help them to decide, actually, maybe I contribute a lot more than my colleagues felt I contributed more than I felt I did. So maybe I'm not as bad as I thought. So it is quite useful there. So when the SAPA factor is greater than 1, it generally tells the students that they've overvalued their contribution, and if it's under 1, they've undervalued it. So really just to kind of show you a few screenshots from the software. So again, we can set up a number of objective criteria on how the students assess themselves. So you can individualize it depending on the project. So we've criteria based on whether students, how they work with others, as well as their own individual roles. And the students will just assess each other based on a sliding scale. You can see here this is average, below average, well below average, and the converse as well on the other side. So they pretty much just drag a point on a scale to assess themselves, and then they'll do it likewise for their colleagues. And as well, they can give a kind of a comment at the end. So really what will happen at the end is that the students will get these 2 factors. The SPA, like we said, is for their individual adjustment of their grade. So you'll see there's student got 0.86. So that means if the group got an award of 65% for the project, this student would have it reduced. So we'd multiply 65 by 0.86, and that student would get an individual mark of 56. Okay, and the SAPA is really just the feedback factor, so that they've overvalued their performance. Okay. Again, the software allows you to kind of apply different statistical methods, whether you want to be, I suppose, reward people who over-contribute, or if you want to be a bit more lenient on the students who don't contribute as much. But again, this will come down to individual choice. In terms of giving feedback to students, you also have the option not just giving these two individual factors. You can display it in terms of radar diagrams. So the students here, you can see the two values, the SPA and SPA. Say the blue radar is showing you their feedback factor. So when that's above 1, they've overrated for one part, and if it's below 1, they've underrated, like we said. And again, a real good valuable tool here is that the students will actually see each other's factors as well. So there's a bit of openness and transparency, and it kind of encourages maybe academic honesty in terms of being fair with your feedback. So the students also get other feedback, so they can see exactly on the list of criteria how they perform. So their own self-rating will be shown with a blue triangle on a different criteria, and how their colleagues felt will be shown the orange one. So again, it's very good for individual feedback in terms of whether I overvalued or undervalued myself. Just a few things with the software is that we do need some element of quality control. So, and this is quite useful in fact for a module coordinator. So we can review the individual comments left for each student, and that literally helps us to identify non-contributors. So students in the group who literally aren't working. We can actually address that quite early, and it's one of the reasons why we have this formative component to this as well halfway through the cycle. Other things to look out for module coordinators really are overraters. So maybe students who maybe accidentally score everyone high. They think everyone in their group is actually above average, but this software is based on a normative assessment. So the average for the group should be average. Okay, so not everyone in the group can perform above average. So it's just really educating students as to that. And then the last thing to look out for is maybe saboteurs, people who maybe provide dishonest feedback or overrate themselves while underrating their colleagues, thinking it'll fix their scores. But there's actually methods, and there's the software kind of gives you advice on how to spot these and reduce their impact or avoid their impact on the scores. So just to summarize, self and peer assessment, it is, I suppose the way we've set up here, it's kind of an innovative task-based group assignment that's very practical, relevant to both cohorts, encourages group learning, but also gets them to self and peer evaluate, which is really important for reflective capacities, and especially in early stage of the cycle. And it gives kind of very useful insights into group dynamics and how groups from different programs can work together. Well, we've used Spark Plus as the tool here. I suppose we've been using it for 5 years. There are other options, and WebPA now is a similar tool that's available through Blackboard function. So you can see it and integrate into your own modules as well. So that's it. So I'd just like to thank Jonathan McNulty, who's literally introduced this into the program when it first started off, and I've taken over as module coordinator since. But that's it. Thanks very much.